we also started having some of the highest success rates. I wanted to make sure that TMS is done in a very thoughtful manner with full input from researchers and experts. So I created the TMS Society, and I authored the International TMS Guidelines. The TMS Society now has one of the few societies in the world that has a combination of both researchers and clinicians. We have people from all 6 continents. So we have, and our practice has access to the best protocols, the best ways to do it, the latest ways to do this. So then I decided, then we also started advocating for insurance. And now that we have almost universal insurance coverage, we decided that we wanted to make it more available, because the science for TMS is solid. The clinical data is much more impressive than even medications. From an economic standpoint, the insurance companies are now seeing that people who do TMS are getting better. There's less doctors visits, less hospitalizations. That's why they decided to cover it. But not many people know about TMS. So we want to make it more freely available. And so what we decided to do was take all our knowledge and our experience and our training and then partner up with Dr. Yang and the Tower Institute, where they've already been doing TMS, but when they work with us, we can do it now and do it through insurance, because Dr. Yang's office does not take insurance. So when you're doing it as part of our affiliate through his office, you will be in network. So most of the patients will have a copay, may not, and then of course if they have a deductible, that's what they'll be asked to pay. So it's very affordable, and what we find is about 60%, certainly in my practice, about 60% of the patients who come frequently, monthly, have ended up trying 300 to 400 antidepressants. Most of them will say that they're doing well. If you do a rating scale, there's still the patients that are the ideal candidates for TMS, and we've treated, I think, more people than anybody else in the country with great success. And we want to do that with Dr. Yang's group and the Tower Institute, where we have our TMS technicians. We work with them. Our staff over here in Connecticut will do the insurance authorizations, billing, etc. And Dr. Yang will be doing the initial treatment, and I will be involved in the team as well, and will be supervising the patients and getting them better. Over the years, we've developed ways of treating depression beyond just the standard approach. The different protocols for different forms of depression, but we also treat other conditions. Remember, TMS is not just an antidepressant. It's a whole different way of treating brain conditions, and that means neurological and psychiatric conditions. It's only FDA approved for depression because, to get each approval costs $20 million and 5 years of research. So there's a lot of research going on in other fields, but we know it already works in other fields. And just some of the other examples would be PTSD. So, if you think about PTSD, it's one of the most difficult disorders to treat. I'm sure the psychiatrists in the room will agree. And we've had tremendous success. We have a special protocol that was used at Walter Reed Hospital for soldiers. And in my opinion, I think it works better for PTSD than even for depression. Obviously, they're working on getting the approvals. OCD, through my affiliation with Columbia, Columbia developed a very good protocol for OCD. We've been using that with excellent results. Generalized anxiety and social anxiety is something we treat. And again, some of these, are comorbid conditions. Somebody who's depressed may have anxiety, and we can actually treat both. We treat on both sides. On the left side, we stimulate the part that is underactive in depression. On the right side, we do slow TMS and suppress the part that is overactive in anxiety. Some of the other conditions, we treat bipolar depression. A lot of our bipolar medications are effective in preventing mania, but only a few are effective in getting them out of the depression. With TMS, we can get them out very quickly out of depression. Certainly, they have to be on a mood stabilizer so that they don't get manic, but that's something, we can observe them for. And then, there's other people who have done a lot of work, and we've treated some people, for the autistic spectrum disorder, especially the mild forms of it. Lots of research on different kinds of substance abuse and cravings. We've done some, not enough on that. The eating disorder family, we've treated very, very effectively, both anorexia, bulimia with TMS. And then from a neurological standpoint, this works even more impressively than for depression for chronic pain. So any kind of, certainly migraines, it's the best treatment for migraines, but also any kind of pain that goes down your neck, shoulders, back, or hips, such as in conditions such as fibromyalgia, we've treated very effectively with TMS. We activate the part of the brain that goes and suppresses the pain. And in things like anxiety and pain, people actually show improvements as early as 1 week. With depression it's 3 weeks, but for anxiety and pain, it's a lot sooner. And we've had very good success with those. Now, some of these conditions are off-label. But if the patient has comorbid depression, and if they try 3 to 4 antidepressants, then we get the approval and then treat both conditions. Sometimes they don't have the comorbid condition, but patients are willing to still pay out of pocket, try it for a week. If it works, then really continue the treatment. If you're in a lot of pain, and if this is the one thing that can help you, then it's worth trying. Again, these are areas where the research is still continuing, so I cannot give you percentages, but I will say about 50 to 60% of patients is what I feel get better, and they know that pretty early on. We've treated early stage of Parkinson's, which is very rewarding, but not only can we treat the depression associated with Parkinson's, but also some of the motor symptoms. Again, the early stages, not late stages. So those are just a few of the conditions that we treat off-label. And in terms of populations, while it's FDA approved for depression, we have treated children at a very young age. We treated pregnant women and people with other medical conditions. Even people with seizure disorders, there's no problem in doing TMS with them. So that's our experience. Those are some of the conditions we can treat. Now, if you have patients or if you yourself are interested, you certainly want to talk to the staff at the Tower Institute. They'll put you on to us out here in Connecticut. We will get the insurance approval, usually within 2 weeks, and then get you started. And our staff will talk to you about whatever obligation you may have in terms of co-pays and that. But this really is something that you want to think about. Again, if you're a physician or a clinician, for your patients, and then for those of you who are lay people, if you're thinking about it for yourselves or family members, because one of the reasons I went into psychiatry is when your mind is depressed, everything around you feels depressed. It really alters your everything around you, and everyone else around you also tends to suffer. So if this can really make a difference in your life, it's worth considering. So I want to stop here.